Hi, this is Stephen. I'm a doctor who specializes in the heart, and the goal of these videos is to provide Chalk Talk style education around echocardiography or ultrasound of the heart. These do not consist of medical advice. These are just educational in their nature, and any views expressed are my own and do not reflect those of my employer. With that, let's look at basic views used in echocardiography. And so here we've got the patient's head, got their torso, and let me draw in. Their heart would be right here. And in parasternal long axis, this is the footprint of the ultrasound probe, parasternal long axis. What would you see? Well, you would see the left atrium, which empties blood via the mitral valve into the left ventricle, and then blood flows out the aortic valve to the aorta. The left ventricle, let's show some of the thick muscle here. And then the right ventricle up here. Let me label these. So you've got your left atrium, you've got your mitral valve leaflets, you've got your left ventricle, your aortic valve leaflets, and your aorta. And up here you've got your right ventricle. Now you can take your transducer, and if you tip it medially, you'll see a slightly different view. Still in parasternal long axis, you'll see something like this. You'll see the right atrium that empties blood via the tricuspid valve into the right ventricle. So this is the right atrium. These are the tricuspid valve leaflets, and this is the right ventricle. So that's parasternal long axis. Let's now look at parasternal short axis. So again, you've got your patient's head, and then torso, arms, with the heart sitting right here. And in parasternal short axis, you have the probe in the same place, but you rotate it 90 degrees. Parasternal short axis. And what do you see? Well, you'll see something like this. It looks like a donut. So this is the left ventricle. And then you'll see the right ventricle up here off to the side. And you'll see papillary muscles. I'm going to shade in the left ventricle here. And let's label our left ventricle and our right ventricle. And these are our papillary muscles. Now, if you tip the probe towards the patient's head, you will see this. You'll see again the muscular left ventricle, which I'm going to shade. But you'll see what looks like a fish's mouth inside. And then you'll see the right ventricle, again, off to the side. So LV, RV, and this is actually the mitral valve. And if you tip it still further up towards the patient's head, you'll see what looks like the Mercedes-Benz logo, the aortic valve, and around that, you'll see the following structures. So you'll see the right atrium, which empties blood via the tricuspid valve into the right ventricle, which empties blood via the pulmonic valve into the pulmonary artery. And then down here is the left atrium. So let's label each of these. This is your left atrium. You've got your intraatrial septum. This is your right atrium, tricuspid valve leaflets, the right ventricle, your pulmonic valve, and then your pulmonic artery, which branches into the left and right pulmonary arteries. And in the middle, you have your aortic valve right here, this Mercedes-Benz. And if you look carefully, you may actually see your left main coronary artery coming off of that cusp, and you may, if you pan up a little bit more, see the right coronary artery coming off of this cusp. And as such, this cusp of the aortic valve is called the left coronary cusp. This cusp here is called the right coronary cusp, and then this third one is called the non-coronary cusp. So that's what we see with the parasternal short axis. Let's look at another view. So again, here's our patient's head. Here's their torso with arms, and their heart sits right here. The next view we'll discuss is the apical views. So the probe footprint is down here at the heart's apex. Apical views. And what do you see? Well, you'll see, the first view you'll see, the apical four-chamber view looks like this. You see the left atrium that empties blood into the left ventricle. Show the muscle there. And then over here, you'll see the right ventricle, and you'll see the right atrium. So over here, just label these: left atrium, mitral valve, left ventricle, right atrium. I'm going to use a different color for the tricuspid valve leaflets. Tricuspid valve and right ventricle. And how do you know which is left or right? Well, the left typically larger and muscular as I've drawn, but on the right side you may see a little moderated band. And most importantly, if you look at where the leaflets insert for the mitral valve versus for the tricuspid valve leaflets actually insert a little bit closer to the apex. And so if you look at the length of your right ventricle versus the length of your left ventricle, I've exaggerated it a little bit here, but you see how the left ventricle is actually a little bit longer. So that insertion of the mitral versus tricuspid valve, that's very helpful in knowing which ventricle is which, particularly in congenital variances in anatomy. All right, so let's clean this up. And then, now if you take your probe that's down in the apical four-chamber view and rotate it about 60 degrees, you'll see this view. You'll see the left atrium that empties blood into the left ventricle. So to label these, we've got left atrium, mitral valve, and left ventricle. We'll talk about this view more with wall motion abnormalities. It's helpful to be able to look from an ejection fraction. It's helpful to look from two different angles. And then if you rotate it another 60 degrees, you'll see something like this. You'll see the left atrium that empties blood into the left ventricle. You'll see the aortic valve, and you'll see the aorta. And let's just give a little thickness to the left ventricle there. And you'll see the right ventricle right up here. Now this may be familiar to you. Let me label these again. So left atrium, your mitral valve, left ventricle, your aortic valve, and your aorta. Right ventricle over here. Now if you recall from our parasternal long axis, it's very similar to the very first view we looked at. And you're actually looking at all the same structures, you're just looking at from a different angle, but it does actually look very similar. Let's talk about one last angle that we can look at the heart, from which we can look at the heart. So here's the patient's head and their torso with arms, and here's the heart. The last view is and this is where the footprint of the probe would be, is the subcostal view. And from the subcostal view, what you'll see is something like this. You'll see the left atrium that empties blood into the left ventricle, and you'll see the right ventricle here, and you'll see the right atrium there. Let's label this left atrium, mitral valve, left ventricle, right atrium, tricuspid valve, and right ventricle. So these are the main views that we use in echocardiography: the subcostal, the apical, the parasternal short axis, and the parasternal long axis.